Hello, people. Good morning. This is Dr. Greg from Celebrity Dental Clinic Owerri, and today we're going to talk about toothache, which is actually pain or inflammation within or around the tooth structure. It's usually caused or commonly caused by dental decay, which is neglected or unattended for a period of time. And so because of that, it will progress to the other part of the tooth structure, which are more sensitive to pain. And so the individual start having pain. Apart from toothache, other possible cause of toothache will actually be trauma. Maybe you had a fall or somebody hit you on the face or any part of your body, or you had an accident like road traffic accident or whichever way, and you had an accident and you traumatize your teeth or the chips or cracks or even broken parts of the tooth, which will expose the inner part as well that are sensitive to pain. And so you start having pain with that. I will first of all deal more on the aspects of tooth decay because that is the commonest cause of what toothache. When you have a tooth decay, especially if it's within the surface of the tooth, the part of the tooth that we call enamel, it won't exhibit any pain. You won't have any pain at that point in time. And that is the point where you're supposed to see your dentist. Even if you are not aware, by the time you brush regularly, you should be able to check your mouth if you have any black spot or any part of your teeth. All right. So if you see something like that, you should be able to say, okay, no, this is not the real color. I need to see my dentist, even when you don't have pain. Because if it is left that way, it will definitely progress to the part of the tooth that are more sensitive to pain, like the part you call a dentin. When you get to that part you call dentin, you start having a little sensation when you take even water, cold water, especially, or sweet drinks or any juice like that. You start having that shocking sensation. It is a signal that something is actually wrong. All right. If at this point you still do want to go or you want to patronize chemist or any other pharmacy for drugs or anything, or you think that your toothpaste can actually take care of it, then it may end up progressing to the point where you start having what we call spontaneous pain. The pain comes on its own, whether you eat anything or not, the pain comes. And so that is when it becomes severe. And so in the night, you say you won't be able to sleep. These are very severe cases of toothache. At this point in time, it must have progressed to the part we call the pulp. And so at that point, it is called pulpitis. That is the infection in the tooth that we call pulpitis. And so when it gets to that level, you won't be able to have sleep. You have difficulty in chewing, especially when things get into that place. And so at this point in time, you still don't need to wait. You still don't need to patronize chemists or pharmacy to take drugs. But drugs does not cure toothache. It's just an adjunct to treatment. So you may possibly take medication and the drugs may possibly take care of the inflammation and the infection going on inside the tooth for a while, but it doesn't cure it. Over a period of time again, it will come back again. So you're actually delaying the time to save that tooth. But if at that point you come to a dentist and the dentist check very well, there is the possibility of doing a root canal for you so that you can save that tooth. You don't need to wait. Or possibly they remove the tooth for the pain to go. Those are the two options that can actually help you at that point in time. If you have a very severe toothache, try to see your dentist. It's very, very important. And so how do you find out that you have a hole or you have decay on your tooth? Yes, when you brush your teeth, look at the surfaces of your teeth, the chewing surfaces, most especially, they have grooves. So when the time you start seeing black spots on that particular grooves and every other part of the tooth that it doesn't seem all right for you, then that is the point to act. Don't wait. Just see your dentist, even if you are not having pain at that point in time. For sure, when you see your dentist, they'll do filling for you. At that point, it will be cheaper for you to do the filling and save that tooth. Because if you progress to the point whereby you start having serious pain, trust me, you may end up removing or losing the tooth, or you spend so much money fixing that tooth. That is that about tooth. Please check very well. And again, I want to emphasize more on this aspect of you getting medication for toothache. Yes, at that point where you'll be having severe pain and you don't have access to dental care at that particular point in time, I think yes, you can get some medication to calm it down, or even painkiller to calm it down. But don't feel that when it's calmed down, it means it's cured. No, you still need to see your dentist. Best treatment for tooth, if you have a severe case of toothache, is either you remove the tooth or a root canal is done on that particular tooth so that the tooth can still be there for you to use for chewing and every other thing that you need it for. That is that. I believe a little bit of this has been attended to. If you have any questions or any contribution or any experience you had about toothaches, please share it in the comment section. Thank you very much for listening. See you another day. Have a nice day. I'm still Dr. Greg from Celebrity Dental Clinic Owerri. One love.